So the information that we're receiving from our hospitals and care facilities within the region, the Iowa National Guard, especially our team, we're doing a great job of processing that information, which is allowing the Department of Public Health and the government officials that are at the levels to make appropriate decisions are making an informed decision with accurate information. Major Gabriel Whitaker.
And what is your title, sir?
I am the Regional Medical Coordination Center 1 officer in charge. So the RMCC, the Iowa Army National Guard, is working with the Iowa Department of Public Health in order to provide real-time data that's been validated that our healthcare providers can use to ensure that resources are getting to where they need to be, whether that be PPE, open beds, or staffing, or anything else as we try to address the COVID-19 response. The Iowa National Guard is, we're in support of the Iowa Department of Public Health, ensuring that we are kind of helping manage data and put it into analyzed products that gives them a better view of the situation across counties and our areas and the state. As we've seen multiple times, whether it be floods, tornadoes, winter storms, the Iowa National Guard, we get called up to support the state in times of crisis. This is just a different situation, and so now we're supporting the Iowa Department of Public Health in our overall mission of supporting the state of Iowa and our citizens here in Iowa. So our soldiers were activated and came on ready to perform a duty that none of them performed on a regular basis. We actually brought on another of our officers that works in data management and IT, and we're changing processes as we go in order to even more quickly analyze data and provide better products to those decision makers. So the big part that we're providing is the situational awareness for those that are making decisions at the state level, at the region level, and the county level, to ensure that they are as fully informed as we can possibly make them at this time.
Please rest assured that the Iowa National Guard, the Department of Public Health, and the rest of the state agencies that are supporting this response, and local agencies as well, are doing everything in our power to keep you safe, to make sure that we have the available resources that you may need if you would become sick. We're preparing for the worst, hoping for the best, and we will take care of you. That is our mission, and we are working diligently to make sure that the resources are there, that you can be taken care of. The reason this works so much better than necessarily a statewide or at a county level view, it gives us a little bigger geography than a county, smaller than a state, so that we can provide very timely, relevant information to the folks that need to make decisions on the ground as far as where patients need to go, what kind of resources they need, and yet still have the ability to roll that up into a statewide view for state decision makers such as the governor. The first is they've provided us a location. We're in Iowa National Guard facilities around the state. There are 6 of them. In addition to the facilities, they're providing us with personnel to help manage all of the collection, putting the data together, putting it in a form that can be analyzed, that can be used by those decision makers, pairing that with our local, our civilian counterparts to leverage the relationships and the expertise they have within the public health world to come at the end of the day with a really good product that decision makers can have, make good decisions. It's vetted, it's validated, it's timely, and that's the key. I mean, that's the partnership between the Guard and public health. Without the Guard staffing, we wouldn't have the personnel to be able to do this in such a timely fashion and have a fabulous location to do this work. So it's been a great partnership. The beautiful part of this partnership, we all, at the end of the day, have the same mission. We're here to serve the citizens of Iowa. That's why we're all in the fields that we're in. And it's able to take something that on the surface doesn't look like a natural partnership between the National Guard and public health, to be able to show how that we can work together to provide better care, to make sure that we have the resources available to care for the citizens of Iowa, working in partnership with our local hospitals, local public health, long-term care facilities, to be able to get data, have the best information we can have for decision makers to make decisions so that we can keep the citizens of Iowa in a true healthcare setting throughout the evolution of this disease that is COVID-19. These regional medical coordination centers are kind of a new partnership between the Guard and public health. And it has come about because of a need to be able to more rapidly gather data, analyze it, and make use of it. But the need is not because any one piece of this system has failed. The hospitals have been preparing for many years. The state has been preparing for many years. But this is a unique experience that is hard to imagine when you're developing plans and processes, and I think this shows how good the Iowa National Guard, the Department of Public Health, and others are at making plans and being flexible enough to respond to any emergency, to protect the citizens of Iowa, because that's our ultimate mission.
Great.
Some, and that's, like I said, that can get difficult.
But they're adding it to Lingo, aren't they? I just feel like I'm suspect. A short little display.
Well, I mean, we don't want to compete. We've got to go to the RMO. And get, the question would be, but that's
Yes, so that we have
we had a chipper, and the chipper broke.
So you have to put 1,400.
we still are trying to input the backlog of data that we have.